everyone, and welcome to our Monday Minute. Today I want to share with you some information regarding the March update to the Interpretive Guidelines for Home Health Surveys. In these Interpretive Guidelines, they have made several updates. I'm going to need to refer to some of them today to make sure I don't miss anything. They have combined some G tags in this, so in the end, there will be a fewer number of G tags that can be utilized. But the thing you have to understand is that they are combining G tags when this occurs. They are not taking away or deleting any previous G tags. They are adding survey procedures to many of the tags. This will help the surveyors not only understand the exact procedure they're to follow in assessing the G tag, but it will also help agencies prepare for their surveys and understanding how the surveyors will specifically approach. They have, of course, updated the language for allowed practitioners versus where the use of physician has been used exclusively in the past. And one pretty significant change that they have made is on several of the conditions of participation. They have added a statement that I want to read to you. The manner and degree of noncompliance identified in relation to the standard level tags for this condition may result in substantial noncompliance with this COP requiring citation at the condition level. The thing you do not want to misinterpret is that if the G tag does not have that statement, it does not mean that that condition could not, that G tag or that condition of participation could not be elevated to the level of a condition level deficiency. So in a nutshell, just to wrap up again, even if the statement I just read to you is not present on the tag, understand that it can still be elevated to a condition level deficiency if your surveyor feels that that is necessary. Our feeling is that the tags that have that specific statement added to them will cause the surveyors to possibly focus more intently on those items, knowing that CMS has specifically stated this additional language regarding them being possibly a condition level deficiency. The Infection Prevention and Control Interpretive Guideline had a pretty significant update where they have included sources for your infection control standards, which is not unusual. However, they are requiring in the interpretive guidelines now for surveyors to not only look for the agency to have stated their source of their infection control standard, but they are looking for you to explain why you specifically selected that source and how it is most applicable to the practice within your organization. There were some other updates to infection control and prevention, which of course is a significant piece of compliance with quality of care. So please make sure you do pay attention to those. Another material change to the interpretive guidelines was to 484.60, the Home Health Plan of Care. The significant change here was that they are now specifically stating the agency is required to document all pertinent diagnoses for the patient. These are to specifically relate to the home health plan of care. So more recently or prior to this update, the diagnoses were required to be listed for every single diagnosis the patient had. And in some cases, that would turn into 40 diagnosis codes. And so you do need to understand that the interpretive guidelines are leading the surveyors to review your chart to include all pertinent diagnoses. And it specifically states the diagnosis most related to the current home health plan of care. They have also clarified that you are to include all supplies and equipment that are medically necessary for the patient's care. And basically that means that if the patient has a wheelchair, a walker, crutches, and canes in the home, but they haven't used the crutches in 10 years and the cane is sitting in the corner and never used, and they only use the wheelchair and the walker, then the wheelchair and the walker is what would be listed on the plan of care. There have been clarifications to the comprehensive assessment completion, specifically the medication review. There has been much discussion and much confusion in the past. This new interpretive guideline does specifically clarify that any discipline that is treating the patient, skilled discipline, registered discipline, can review the medication profile. In the past, there has been an emphasis on nurses reviewing the medication profile, regardless of who had been ordered to provide services to the patient. But this interpretive guideline very clearly states any discipline that has been ordered that you as an agency have identified, have the ability to review the medication profile, would be able to do so. As you see, there have been numerous changes to the interpretive guidelines, some significant, some not so much. But the reality is it does give us more clear insight into the next survey that you might be preparing for in home health. Healthcare Provider Solutions is equipped with CHAP and ACHC certified consultants that would be thrilled to assist you with these interpretive guidelines and with any mock surveys that you might find necessary in preparation for your next survey. We also want to remind you that we have a 2-day workshop for home health coming up in August of 2024 in Nashville, Tennessee, where we will have the COO of CHAP, Teresa Harbor, joining us for that 2-day workshop where she will cover survey preparedness. Have a fabulous week.